The first question I always ask patients is, are you stiff in the morning and how long does that last? Generally, other causes of arthritis, such as osteoarthritis, can cause some stiffness, but no longer than 30 minutes. But when a patient says that they're stiff for an hour or 2 hours, maybe all morning long, I start to think about rheumatoid arthritis because that suggests inflammation. The diagnostic criteria for rheumatoid arthritis involves pain and swelling in multiple joints. It's symmetrical. It's associated with increased inflammation or inflammatory markers in the blood, and it needs to be persistent for at least 6 weeks. If a doctor suspects the patient has RA, the next step would be to refer them to a specialist, where a diagnostic workup would take place. The first part of a workup is always asking the history, so making sure that the joint pain suggests that there's inflammation. So that's looking for some of the symptoms of stiffness, especially in the morning, looking for the symptoms of swelling, along with the tenderness. So the first thing we look for is range of motion. When a joint becomes inflamed, the capsule of the joint or the synovium becomes very swollen. So that actually physically impedes the joint. So it's sort of like if you shoved a sock in the hinge of a door, you wouldn't be able to move the door as well. Similar with a joint. So you've shoved this inflamed synovium in the joint, and now you can't move the joint as well. We also look for tenderness. So when we squeeze the joint, when we press on the lining of the joint, does that cause the patient discomfort? And then warmth. So the joints should be cooler than the rest of the body because there's no active blood vessels going through the joint. But when you've got inflammation there, they become very warm and hot. So we look for that as well. When we draw a blood sample for rheumatoid arthritis, we're looking for levels of inflammation, and then we're looking for antibodies that tend to go along with rheumatoid arthritis. There are two tests, the ESR, which is the sedimentation rate, and the CRP, which is a C-reactive protein. And those are proteins that are elevated when the immune system is active. And we also look for rheumatoid factor and CCP, which are antibodies that the white blood cells produce in rheumatoid arthritis. Another important part of diagnosis is getting x-rays. That tells us about the health of the bone, and it tells us whether or not rheumatoid arthritis has started damaging the bones or the joints. So we like to get the x-rays at the start, and we like to get them periodically during treatment to make sure that we're protecting the bones by preventing inflammation. You can make a diagnosis based on the history and the exam, a lot of the blood tests, and so we can be pretty sure that a person has rheumatoid arthritis. There's a lot of relief in knowing. Many patients have felt ill for some time and just want their lives back. So I think that people tend to be happy, and having the diagnosis really tells the patient, this is not you. You're not just tired or lazy or, this is an illness that's affecting you, and you've got to shift your life in this way.